the alcohol-related liver disease rates had gone up fairly
Mm.
dramatically, that we had 60% increases in waitlisting and transplants for patients with acute
Wow,
alcoholic hepatitis. Yeah, for liver transplant.
60%. With the number of women suffering from alcohol related liver disease rising sharply, we want to reshare an episode on this crucial topic. Dr. Jessica Mellinger, a liver specialist at the University of Michigan, is on a mission to raise awareness about what moderate drinking really means in hopes of turning this deadly trend around.
Women are starting to kind of pick up the pace, and they're starting to drink kind of more like men. I think there is an erroneous assumption that it's okay to drink, that wine is fine, and no matter how much wine you're drinking, it's okay.
I'm Angela Kennecke. Welcome to Grieving Out Loud. Historically, alcohol use disorder has disproportionately affected men, but recent data from the Centers of Disease Control and Prevention shows that rates among women are rising much more rapidly. We hope today's episode will shed light on this preventable crisis. Well, Dr. Mellinger, thank you so much for joining me for this episode of the podcast. And it's a little different. A lot of times on my podcast, we talk about, family members struggling with someone who's addicted, especially to substances such as meth or opioids, or we talk about people who've lost people through addiction. But now we're going to talk about women and alcohol, which I think is first of all, is a huge market out there. Alcohol companies are marketing to women. And I see almost all the women around me drinking on a pretty consistent basis.
Absolutely. Well, thanks so much for having me on. I appreciate you, shedding some more light on this topic, and helping people understand kind of what a problem this is becoming for many women in the U.S. too.
Well, let's talk about just the whole idea that is such a big part of our culture now, especially for women, and I think wine and maybe mixed drinks too, but especially wine. I see that with my own peer group. Like if we go out, we're going to have wine. And maybe it's something that I've seen people that I know drinking quite a bit of wine during the week. Is that typical now in society, do you think?
Well, certainly just the trends overall for drinking in general have been increasing for years, and they've been increasing a bit more sharply for women. And we've been seeing this for, 15, 20 years now, where the bulk of people who drink are still men, the majority. But when you look at the rate of increase, like who's drinking heavily, women are starting to kind of pick up the pace, and they're starting to drink kind of more like men. I think there is an erroneous assumption that it's okay to drink, that wine is fine, and no matter how much wine you're drinking, it's okay, because it's viewed as, I think we have views of what someone with an alcohol use problem looks like, and it's not a woman with a glass of wine, right? Like that's not the vision that we have in our head of somebody who has an addiction or who has an alcohol addiction, or what we call an alcohol use disorder now in addiction research. And so it can be easier to overlook, perhaps, when that one glass of wine turns into two, turns into three, turns into the bottle, turns into a couple of bottles. There's messaging around wine that it's healthy, right? That it's good
Mm.
for your heart.
Red
And
wine, especially, right? Yeah.
exactly, yeah, there's a lot of
Uh-huh.
messaging around that. And I think there's just a lot of messaging and advertising targeted towards women to promote drinking, and especially drinking of wine, as just what women do to connect with other women, to connect with your friends, to have wine down Wednesdays, so rosé all day, those kinds of things that really normalize the idea of drinking, kind of all the time, and drinking to be more sociable, drinking to put up with or cope with the stresses of being a woman, the stresses of being a mom. You'll see, this is mommy juice, and kind of tongue in cheek references to, wine is cheaper than therapy, and kind of some of these, funny, quasi funny, not really funny taglines that you might see on social media, but that serve over time to really normalize the idea of drinking in larger amounts for reasons that are totally unrelated to what alcohol should be used for.
So let's talk about what is considered. Well, I have a whole bunch of questions for you. First of all, the idea that wine is healthy, the idea that red wine is healthy, I think is, in my opinion, from the research I've read, is a bit of a misnomer. Like you'd have to have a lot of wine. I mean, to get the benefits of red wine, but then you have the down part about alcohol, that on your system. So is it healthy or not?
Well, I think the data is very mixed. And so there has been some data that has suggested that wine, especially red wine, can be beneficial for cardiovascular disease. That data is being questioned by kind of greater and greater studies that are showing that, in fact, maybe that isn't true. And that also take into account the other risks of alcohol use. So if you just look in isolation at cardiovascular disease, you're going to miss, all the downsides of drinking, which could include getting liver disease, kind of my area of specialty, cancers. Alcohol use is associated with a whole host of cancers. And then the kind of associated mental health issues that can happen along with that increased depression, increased anxiety, insomnia problem. Alcohol has a lot of downsides to it, and so I think the overall message that wine is healthy is really starting to be questioned by many studies. Certainly in my clinic for patients with liver disease, it's not healthy. It's not something that, we obviously want anyone with liver disease to be consuming, because
At
alcohol
what
is
point?
alcohol no matter how it comes into your body.
Right, right. Whether it's vodka or wine or whatever it
Yeah.
is. At what point are people at risk for liver disease?
So it depends. So there's some differences in, I think probably one of the biggest factors that could influence, how much is too much is if you're a man or a woman. When we think about the NIAAA, or the National Association for the Study of Alcohol here in the U.S. through the NIH, which is the National Institutes of Health, their recommendations for a safe level of alcohol for people who don't have an alcohol use problem, who don't have liver disease, who don't have medical issues from alcohol, is no more than 1 drink a day for women or 2 drinks a day for men. And then that raises the question of what is a drink, right? So it's 1 drink is about 4 ounces of wine. So that would fill up really only the bottom, right,
Yes. You
of a
think
wine
about a
glass.
typical wine glass, and so, if I'm going to fill up a wine glass, I'll fill it up about halfway full, which
Right.
is two servings, right?
Probably 2 servings, yeah. And
Wow.
then 1 shot is 1 serving, 1 standard 12-ounce can of beer is 1 serving. And that's of the typical kind of percentage of alcohols that we have had in the past. A lot of the newer IPAs and the microbrews and so forth have actually a higher concentration of alcohol in them. So
Hmm.
you may have a beer, 1 serving of one of those more highly concentrated alcohol drinks, and be getting 2, 3, or more servings of alcohol in that. So for women, for a variety of reasons, our body size, largely how we process alcohol, where the enzymes to process alcohol are in our body, and how many of them there are, how much of them there are in our stomachs and in our livers, we can't drink as much as men, and about half as much as men, before we start to see the consequences. So if you, from a liver disease standpoint, let's say, if you drink heavily, you know, uh, more than 2 or 3 drinks per day for several weeks, you will get fatty liver from that. So there will be fat accumulated in your liver, and like 90% of people will get that. Now, if you stop drinking, that can go away. That can get better. So when I drive through, the University of Michigan down here around fall, and I see, the flurry of red Solo cups and everybody's drinking and all the
Yeah.
kids are drinking, probably all are getting
Yeah.
fatty liver. A
Oh, really?
proportion of those people, yeah, a proportion, about a quarter to a third, if they keep drinking heavily, will go on to get inflammation in the liver. And then a proportion of those, you can think of about a quarter to a third, will go on to get scarring that can become cirrhosis. And that's what cirrhosis is essentially
Mm.
just a lot of scar tissue that has accumulated in that liver, usually over many years.
Because the alcohol is like rough on the liver, right? I mean,
Yeah, it
and
inflames
that
it and irritates it.
yeah, and causes
Yeah.
the scars.
Yeah.
And
It's
so
kind of just
are
like you
there
get a cut on your hand and it gets inflamed, you get a scar. Same thing happens in your liver with alcohol.
are there symptoms of having a fatty, how do you know if you have a fatty liver or not? If you've, been drinking with, a couple drinks every day, 2, 3 drinks every day. How do you know?
You probably won't know. You won't feel it
Hmm.
at all. So fatty liver is really essentially silent clinically. We pick it up with ultrasounds, imaging, we might see it, or with liver enzyme elevation. So if we check your blood tests and we see that your liver looks a little irritated, maybe your liver enzymes are up, that could signal us to go look for it, and then we can see it, on some of our imaging techniques. But you won't feel it. Like, you don't really feel anything.
So it's not until the disease progresses that you're going to know.
Yeah, and if you're feeling symptoms of liver disease, you're at an end stage, you're at a later stage of liver
Oh,
disease. So by the time someone is feeling, the classic symptoms of liver disease that you would see or notice would be yellow eyes or yellow skin. Maybe your belly swells up with fluid and you look pregnant. Or you bleed, you vomit blood, you have, you're passing a lot of blood through your stool because of bleeding in your esophagus. The cirrhosis is there. It's been there. And now you're kind of at a later stage, once you're developing symptoms. So it becomes really crucial for us to, figure out ways to find this earlier and help people stop drinking so that we can reverse some of that liver disease before people get to the stage of feeling it.
right. Can it, I know there's a difference between someone who's suffering from substance use disorder and someone who this may just be their lifestyle, right? Or they may just look at it from, or maybe be psychologically unable to stop because there's a relaxation effect to wine.
Sure.
There's it could be a habit. How do you know if you have a problem versus, you just like to have wine once in a while or
Mhm.
beer or whatever it might be.
Yeah.
I'm
Well,
saying wine because what I like, and I
that's what you
don't
like,
drink
yeah.
that much of it, but I try to limit it to like 3 to 4 times a week, one glass, and that might be too much. Maybe. I don't know.
Well, I
Yeah.
think if you're asking yourself, oftentimes what I'm hearing is if people are asking themselves the question, am I drinking too much? You might be. If it's occurring to you that you might be drinking too much, or for some of these reasons, like, you can't relax at night without it now. You're using it to get to sleep every single night. You're trying to cut back, but it's hard to do that. Um, if you are starting to feel guilty about your drinking, if you're needing an eye opener when you get up in the morning, to get
You mean
yourself going.
coffee? Coffee?
What?
It does. Is that an aisle? No.
No, alcohol. Yeah.
A drink.
A
Okay, so I don't
drink.
know that
Sorry.
term. An
Yeah,
eye
sorry. An
opener
eye
is a
opener,
drink.
alcohol. Yeah. So an eye opener
Alcohol.
would be like a drink in the morning
To make you feel
to
better, right? Because your
make you feel
body's
better.
go withdrawal symptoms, right?
Exactly.
Because
You
you
might be getting
Mhm.
tremulous if you're starting to withdraw. So if you notice that alcohol is taking up a bigger and bigger portion of your life, right? Things that you used to like to do that didn't involve alcohol, you're not doing now because you're focused on getting alcohol. When can you get your next drink?
Mhm.
All of your
Sure.
social events involve alcohol, and you don't want to give that up, those types of things. I think so, a lot of those different symptoms of an alcohol use problem or disorder, like we talk about, are often really about how is the alcohol impacting your life, in a negative way, and less about how much you're drinking. The definition of an alcohol use disorder doesn't have anything about a dose of alcohol. It doesn't say you have to be drinking more than this amount to meet the definition. It's really about how is the alcohol impacting your relationships, your work, your school, your body. Have you had a DUI? Have you, had some consequences that are negative because of your alcohol use? That could signal that you're kind of in one of those, in a phase of it being a bigger problem.
I think also it can be tough once you get into the habit of drinking to get out of the habit of it, even if you don't have an issue with it, because I don't think alcohol is healthy at all. And I'm kind of a health nut. I work out regularly. I try to eat very healthy. And then I'm like, so why am I having this glass of wine when I think it's just putting poison in my body? I mean, I just don't think alcohol has health benefits, no matter what anybody says. That's my opinion and from what I've read. But I think it can be sort of a habit or a social habit. So,
Right.
you know, can you, I mean, I think we talk a lot about substance use disorder and how you can't go back to the same people, places, or things. But in today's society, how do you avoid alcohol?
Right. And I think for a lot of people who have an alcohol use disorder, or what we might term addiction, I think some people like that word, some people don't like that word, but
Right.
the
I use them interchangeably, but I
yeah, I
probably
kind of use it
shouldn't, but I do.
interchangeable too. Yeah,
Yeah.
like a substance use disorder, it's very much the same thing. I
Hmm.
think people with an alcohol use disorder who are practicing sobriety and practicing abstinence, often do have to not be around people, places, or things where they drank for a time. Um, but they learn to practice, walking through a grocery store and, practicing with, okay, I walked past the liquor section or the alcohol section and kind of noticing like, oh yeah, maybe I'm thinking about alcohol in that moment, but moving through it, continuing on with their day without, getting sidetracked into drinking. A lot of those skills come about, people have practiced those skills through treatment, through going through alcohol counseling treatment, going to AA or some of the other mutual aid recovery community groups that are out there that can help people manage that exact thing. How do you go through your life and not drink if it was something that was really a big part of your life? It's really about learning. You're kind of unlearning the habit of using alcohol for everything and then relearning how to do some of these other things in life, that don't involve alcohol.
Did you see the effects of the pandemic? I mean, what do the studies show, especially when it comes to women? I mean, I know I've heard that substance use went way up during the pandemic. Now we're a couple of years into it. Is the use going down or did it remain high?
It's leveled out a little bit. So it definitely spiked up, in the months after the pandemic started, about 25%. So roughly 25% more drinking occurring in the US. Now, some of that was people who already drank, just drinking a lot more, because some people did decrease their alcohol use, right? So there's kind of a population that decreased their use and a population that increased their use. But overall, there was about 25% more alcohol consumed, roughly, in the US in the immediate post-pandemic period. And it's come down a little bit, but it hasn't gone back to pre-pandemic levels. So we're still seeing higher levels of drinking kind of continuously based on the data that we do have from the pandemic. And with that has come, a lot of those consequences. So we published that, along with others, that the alcohol-related liver disease rates had gone up fairly dramatically, that we had 60% increases in waitlisting and transplants for patients with acute
No,
alcoholic hepatitis. Yeah. For liver transplant.
60%. That's a phenomenal number, don't you think?
It's a big number. Yeah, it's a big number. And that's kind of an immediate consequence. There'll be more and more data coming out. We've seen the data on suicide rates and
Right.
increases in depression and anxiety. And a lot of it's focused on opioids, appropriately because there is so much death from that. But a lot of times underneath that is people are drinking along with the use of other drugs, and we kind of don't
Mhm.
talk about that as much. But I've
And
certainly seen.
alcohol is a depressant, for the brain. So it's a depressant. So you may be drinking to find relief, but you're actually lowering,
Yep.
your dopamine
It
and
makes it
yeah,
worse. It might have made you feel better in the beginning, but now it doesn't, and now
right.
it's, kind of creating more problems.
The one thing that really concerns me is the parent of college age kids. When I was in college, the drinking was heavy. And of course, I worry about other substances. But I really worry about, I tell my kids, addiction runs in your family and you have to be really careful. But I don't know that they listen. And I just think parents also kind of see drinking as a rite of passage in a way, which I think is a mistake, especially for the developing brain. And so I really worry about that. And I don't know if you have any advice on when it comes to that age group.
Yeah, I think there's a lot of work being done in the alcohol research community focused on that age group, focused on that kind of adolescent and early adult age group around the time of college, to normalize not drinking. I think, I certainly think normalizing not drinking and kind of trying to counteract this message that it's just what you do when you go to college and it's sort of expected that you will get, blindingly drunk and that's how you have fun, And I think to the extent that that kids can see their family members and their moms and dads and their parents and the people that are around them having fun without alcohol, having fun without having to do that, I think that really, sinks into kids that, yeah, I don't have to drink just to have fun. I don't have to drink, to blend in. Finding those, those colleagues and those friends and so forth in college who also don't really want to do that, and aren't really into that scene, I think can also be helpful. And just to the extent that, as families, we can really support our kids in, saying, yeah, it's not really for me. It's not really how I like to have fun. And, it's not necessary for me to have fun. I think is really important.
Right. And I think that some of the hazing and stuff that goes on college campuses, all surrounding drinking. And I know it's going on to this day because I hear stories about it. I wish that the schools would do a little better job, or the fraternities and sororities would do a little better job of curtailing some of that.
It's so
That's the
dangerous.
excess, the
Oh,
excess,
yeah. I mean, you hear
yeah.
cases of kids dying, from
All
from
every
alcohol
year,
poisoning.
every year,
Yeah, and
every year.
it's
Yeah.
so I mean, that's so sad to see those lives cut short because of something, like alcohol poisoning or a hazing incident. It's just it's not worth it.
Right. So are you seeing increased ways of treating, or better ways of treating alcohol use disorder when patients come to see you?
Yeah. Well, there's a lot of different treatment options that I think people should be aware of, and I think we're often not aware of. When I've in some of the studies that I've done where I've talked to my patients and asked them, what when you hear alcohol treatment, what do you think of? They usually think of two things: residential treatment or inpatient treatment, and AA, and that's it. Alcoholics Anonymous, and that's a lot of mostly what people have heard about. But the reality is, there's a whole range of treatments that really can be effective: one-on-one, group therapies, couple therapies, family therapy, residential treatment, intensive outpatient programs, which are not residential but have you go multiple hours a day, multiple days a week to kind of get a big slug of treatment right up front. There's also medications to kind of turn down the volume on the cravings that people have for alcohol. And these are for those of us who don't have an alcohol use problem, I think it can be hard for us to understand just how just how strong that craving to drink can be for people and how frightening it can be for them as they're trying to establish sobriety, to experience these kind of overwhelming compulsions and urges to drink that just kind of appear to really wipe out any rational thought. It's just it's such a compelling urge, and those are most strong kind of right when people are stopping drinking, and they do tend to level off and decrease with time and with abstinence. But we have treatments, we have medications that can turn the volume down on those cravings and give people some of the mental and emotional space from that to work, a program, to work, whether it's AA or to go to a counselor or any of a number of the other, community programs like Celebrate Recovery, Refuge Recovery, Smart Recovery, that are not based on the 12 steps, but also involve, other people with alcohol use problems, helping other people with alcohol use problems. There's just a lot out there, and it's effective. These things work to help people reduce and stop their drinking. So,
Medication really saved a cousin of mine, really saved his life. And he had started
mm,
drinking at 13 and nearly died at about 50, was in the hospital and started on a medication. And also, went to meetings, got some outpatient type treatment, but it was really the medication, I think, that made all the difference in the world. And in that case, I think the medication he took was if he drank, he would get sick.
okay.
So
Yeah. So yeah, there's definitely a lot out there in our liver clinic. So we started at University of Michigan, a kind of novel liver clinic where we have myself, a liver disease doctor, but also a psychiatrist, an addiction psychologist, and an addiction social worker in the same clinic,
that's
so that we can
awesome.
kind of treat people together, come up with a plan for people that works with their medical issues and whatever psychological and addiction issues they're dealing with. Because the liver metabolizes a lot of these medications. So almost everybody that comes into our clinic, when they stop drinking, discovers that they have some other stuff going on. They've got depression, they've got anxiety, maybe bipolar disorder, eating disorders, a lot of trauma, a lot of people, particularly women who have had emotional, psychological, sexual trauma in their past. And so that we need to help them with that. And sometimes medications are an important part of that: antidepressants, anti-anxiety medicines, anti-craving agents. But knowing how to prescribe those in the setting of advanced liver disease, how to dose them, what to use, what not to use, is really important. And so that clinic that we've established, that are kind of cropping up around the country now, different hospitals are doing this, which is great. Can really
That's
help
what I was
people
going to
get
ask you. Are you a model for other places? Because
yeah.
that sounds amazing.
Yeah, it's been a wonderful. We've been doing it now. This is our fourth year. I think we were either the first or one of the first in the nation to do this outside of a transplant clinic. So transplant clinics often have a lot of resources for patients who are able to get a transplant, but there's a lot of patients who can't get a transplant or don't qualify one or don't need one, and we just weren't doing anything for them. So we were really frustrated by that and said, well, let's start a clinic. It's like I'll grab my friends who do psychiatry and psychology, and we, love taking care of these patients. And so we've published some of the results of our clinic, and that has, I think, inspired some other centers to say, yeah, we need to do this too. And University of Wisconsin has one, Mass Gen Hospital in Boston has one, Cleveland Clinic is starting one, and Rush in Illinois is going to start one soon. So there's other places where that are kind of using this model of multidisciplinary integrated care for liver disease patients with alcohol use problems, and it's really great. I think our patients love it. We love taking care of them, and I think it's a step in the right direction.
Oh, it sounds like it. I love it that it's under the medical umbrella, right? So you're treating the whole person. And I
Right.
think we need so much more of that in the addiction field in general,
Absolutely.
because anybody can really hang up a shingle and say they're treating addiction. There's very little regulation out there regarding that. But I feel it really is a medical condition. It's a disease of the brain. And so we need to approach it from that standpoint of the whole person as well.
Absolutely. And that's always our message is that, it's alcohol-related liver disease. If you have ALD, the kind of abbreviation for it, you have two problems. You have an alcohol problem and you have a liver problem. But treating the alcohol use is medical treatment for your liver disease. It's not a
Mhm.
different optional thing. One of the only things we don't have a lot of medical treatments to reverse, or really any to reverse the liver disease from alcohol use. But what does keep people alive is stopping drinking. Like that's very clear. Is if you stop drinking, even if you have advanced liver disease, even if you have cirrhosis or acute alcoholic hepatitis, which is an even more advanced inflammation of the liver from alcohol, stopping drinking reduces your risk of death dramatically compared to those who keep drinking. So to me, it was a no-brainer. Like this is what we need to focus. Like we
Yeah.
really need to focus on ways to help people, reduce and stop their drinking because that's what saves their lives.
Right. And that's what it's all about when you're in your profession, is keeping
Absolutely.
people alive, saving their lives. If you had a magic wand and you could just wave it and change society in general, and these trends that you've seen, of women drinking more and women drinking as much, if not as much as men. And I think about all the merchandise that's out there, like the t-shirts. And I mean, we're just marketed to and we're sold this idea that in general can be really unhealthy for so many people. So if you had a magic wand and you could wave it, what would you do? What would you change?
I would love to see kind of our thinking about alcohol use and excessive drinking be similar to how we think about smoking today.
Mhm.
Similarly, years ago we thought smoking was healthy. We didn't think it was a big deal. We didn't,
Okay.
we encouraged it. Ashtrays everywhere. Doctors encouraged smoking, but over time we learned how dangerous it was, and over time society really changed to now it's much less. People still smoke, obviously, but there's a lot more societally to try to prevent people from smoking to help people stop. And that's what I would love to see. I would love to see that around, you know, alcohol use, excessive alcohol use, et cetera. I don't think we're ever going to, not have alcohol in our society. We've had it since the dawn of time, since people figured out how to ferment corn.
Right.
And so we're never going to eliminate it. And I think the majority of people do drink in a light to moderate way and don't experience, ill health because of it. But we do have such a big chunk of our society that are really, dramatically and negatively impacted by it in a way that also influences their use of other drugs like opioids and marijuana and so forth. These often co-occur that I would love to see us focus on that portion of the population and try to do some things at a public health level to reduce the consumption and help people get better from that sense. And I think a good model is that smoking model of what happened with tobacco use and how we came to understand the dangers of that and really as a society move towards trying to discourage and stop that use and then help people stop. I would love that. I'd also love to see the alcohol paraphernalia be out of hospital gift shops, which I always like
Yeah, hospital
hospital
gift
gift
shops, right? And like people are in the hospital with liver disease,
oh
and
my
yeah, they're
gosh.
selling wine
Wine
purses.
purses. I
Yeah.
know, the wine purse, can you believe that?
Yeah.
It's insane. There was like a wine bean bag that I saw on Amazon or something, like a bean bag chair, and it had like a thing you could sip your wine like directly out of the bean bag chair. I was like, this is insane.
Right, right. Because really, we have to not glamorize it. We've seen Hollywood. We've seen it glamorized, and I think
Yeah.
that it's not glamorous. And being drunk isn't glamorous, and waking up hungover the next day isn't glamorous.
No,
And
it's not.
you know,
And know how
uh,
much you're drinking, I think is the big thing. I see all the time like alcohol containers, cups and portable wine glasses to take to your picnic or whatever that look like, the top of a wine goblet. But when you look at how much it holds half a bottle of wine. So
Right.
somebody could easily grab one of those, drink two, think that they just had 2 glasses of wine when what they really had was a full bottle, right? And that would get somebody's attention, I think. Somebody who thinks that they're drinking moderately, finding out, no, you actually just drank a bottle of wine. You drank 5 glasses of wine instead of 2. I think would get people's attention too about how much they're using.
Right. It's just being conscious of how much you're really drinking. If you think you're having a glass, it could be 3.
Right,
Right.
exactly. Yeah.
So,
We do this with food too, like food. We have the
yeah,
same
of course.
with
Of
sugar.
course.
It's
Right.
enormous amounts,
Yeah.
and we think it is. And yeah,
Yeah. Well, I just appreciate you sharing your wealth of information with our audience today. And thank you so much for being on the podcast.
well, thank you for having me. I really appreciate you shining light on this topic.
Thank you for joining us. Check out our other episodes of the podcast and read my blog on our website, emilyshope.foundation. If you like what you're hearing, please consider giving us a positive review on Spotify, Apple Podcasts, or wherever you listen. Until next time, wishing you faith, hope, and courage. This podcast is produced by Casey Wonnenberg King and Anna Fye.